We are going to look for abdominal examination now. Here we have a volunteer, Mr. Prakash, my father. Hi, I am Sneha, second year medical student. I want to examine your abdomen. Do you feel any discomfort?
No.
Can I proceed?
Okay, yes.
You should remove your shirt and sleep in supine position. If you feel any discomfort, you can stop me at the time.
Okay.
Abdominal examination will start with inspection, auscultation, percussion, and then finally palpation. Palpation should not come at the second question in abdominal examination because during palpation you may trigger your abdomen and there may be false peristalsis, and you may trigger your peristalsis and the result may be false. So inspection, you should look for the abdominal distension. His abdomen is appeared to be distension because he is an obese person, his BMI is more, and then you should look for any scars. There is no scars and there is no stitch mark in his abdomen, and then you should look for any engorged veins. There is no engorged veins. These are appear to be normal, and then you should look for the hematomas, and there is no hematomas in his abdomen. It's appear to be normal. Our abdomen is classically divided into 4 quadrants: right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. There are 9 regions of abdomen. A 9 region, there will be 2 vertical line, there will be 2 horizontal line. 2 vertical line will be taken from the mid-clavicular region, and 2 horizontal line will be taken from the lower border of the lowest rib and upper border of the iliac crest, and there will be totally 9 quadrants. Here there will be left hypochondric region, and here there will be right hypochondric region, and in center there will be umbilicus. Above the umbilical there will be epigastric, and below the umbilical there will be hypogastric region, and in the last part there will be both the sides iliac fossa, left and right iliac fossa will be there. And next we should look for the umbilical. Umbilical is appeared to be normal. Normal umbilical is inverted, and we should look for the distance between the xiphisternum to the umbilical, and then umbilical to the symphysis of the pubis. And then everything is appear to be normal in this person. His abdominal is distended because he is an obese person. And then next we should proceed for the auscultation part. Auscultation, you should look with your diaphragm or with your stethoscope. And then in abdomen, normal abdomen, you can hear the sound of clicks and gurgles. In abnormal abdomen, there could be an hyperactivity or there can be an absence of sound. We should place our diaphragm of a stethoscope in a point for at least 5 minutes. If more than 2 minutes you couldn't hear the sound, there is an absence of sound. And if you hear more sound, that is hyperactivity. Hyperactivity could be heard in case of infection or anything. Absence of sound could be heard because of any post-operative damage or because of peritonitis or other conditions. Let us proceed with the auscultation part. You should look in an aortic area to look for any aortic aneurysm or aortic stenosis is there. When you keep your diaphragm of your stethoscope, you could hear and sound. Everything is appear to be normal in this patient, and next we'll proceed for the percussion part. Next is percussion. Your finger is your pleximeter. You should percuss like this, and you should look for the dull sound or tympanic sound. Dull sound is heard in solid organs and tympanic sound in an air-filled organs. When you palpate your thigh, you could hear your dull sound. Same dull sound will be heard in the abdomen. And then in the air-filled surfaces, you could hear your tympanic sound, like a drum sound it will be heard. Let us look for its sound. most reliable to check ascites is shifting dullness. In shifting dullness, ask the patient to lie supine. When they are lying supine, the fluid will go and settle in the downwards and the air will be settling in the top. So when you percuss, you could feel the tympanic sound as you hear in an air-filled surface. And ask the patient to lie to one side so that the fluid will shift to that side and the other side there will be air. And you could feel the shifting dullness. The dullness will be heard in the fluid side and then you could hear the tympanic sound in the air-filled surface. Now let us percuss and see. He is not an ascites patient. Only in case of ascites patient you could feel for the shifting dullness. Ask the patient to shift towards one side. Can you shift to your left lateral side? Yes. From left side to right side you should percuss so that you could feel the dullness will be shifting from one side to the other side. Now ask the patient to lie in again a supine position. Now let us proceed for the palpation part. In palpation part, if a patient is explaining a pain towards one side, you should palpate that portion at the last only. Before you should palpate the other regions. Why? Because if you palpate that portion and patient is feeling pain and he will try to guard from that pain and then you cannot proceed with the other portion correctly. So you should proceed that portion at the last only and try to distract the patient by speaking to the patient so that he will not guard the abdomen. If he guards the abdomen, the muscles will become stiff and you cannot palpate exactly. First, in palpation, there is two types of palpation, superficial palpation and deep palpation. First, we should start with the superficial palpation. You should not palpate in this direction. If you palpate in this direction, you might poke the patient's organ and he will feel the pain. So you should always palpate in this manner. You should first do a superficial palpation. Look for the patient expression. If he feels pain, he will show us in expression. There is no tenderness and there is no pain in this patient. Now let us go for the deep palpation. In deep palpation, you should give more force. Now let us go for the palpation of the liver. In normal patient, we could not feel the liver. In hepatomegaly patient, we could feel the liver more prominently. Where is liver located? It's located in the right upper quadrant, but we should go palpating from the lower to the upper portion of the right quadrant. While palpating the liver, you should go from the lower to the upper side. Though liver is located in the right upper quadrant, you should go from lower to upper, because in hepatomegaly patient, the liver may be very large, so it will be in the lower quadrant also. So you should palpate in this manner. This is a classical way of palpating the liver. And then there are three methods of palpating the liver. That is classical method, hooking method and dipping method. Hooking method, you should keep your hand in this position and then you should try to hook up the liver. And in dipping method is done in case of ascites patient. As there will be more fluid built, you should go deep into it to palpate the liver. In normal patient, it's difficult to palpate the liver. In case of hepatomegaly, it could be easily palpated. Now let us palpate for the gallbladder. In gallbladder palpation, you should measure from the mid-clavicular line and then you should palpate for the gallbladder. Ask your patient to exhale. Ask your patient to exhale and then you keep your hand and then ask the patient to inhale. In case of gallbladder infection like cholecystitis, the patient will be abruptly stopping the inhalation and they will feel a sudden pain when you palpate. So this is a positive Murphy sign, but this patient is not feeling any pain. So this is a negative Murphy sign. Next we'll look for the spleen palpation. Spleen palpation should start from the right lower quadrant to the left upper quadrant. From the right iliac fossa to the left hypochondric region. You should ask the patient to exhale and then ask the patient to inhale.
Mucho.
You could feel the spleen, but in normal patient you could not feel the spleen. In case of splenomegaly only, you could find the spleen prominently. Next we'll proceed for the kidney palpation. Kidney palpation is a bimanual palpation. Bimanual in the sense you should use your two hands in palpating the kidney.
Your one hand on the posterior side of right lumbar region and do a deep palpation with the other hand on the anterior side of the right lumbar region. Repeat the same procedure on the other side also.
Ask your patient to sit in this position and then palpate for the 12th rib. And in the costovertebral angle, CVA angle, keep your palm and then keep your another fist like this and then have a hit. If the patient is having any pain in the kidney, he will have shout, he will feel tenderness. And for palpating the right side, you should keep your hand like this and keep your hand in the fist and then hit like this. He doesn't feel any pain, so there is no kidney tenderness. Now let us look for the maneuvers of appendicitis. Appendicitis, you should look for the direct right lower quadrant pain. First, in appendicitis, you should look for the direct right quadrant pain, right lower quadrant pain. When you touch the patient, you might feel any pain. This patient is absolutely normal, so he doesn't feel any pain. Next, in Rovising sign, you should press on the left side and the patient might feel the pain on the right side, because when you press on the left side, this muscle will hit on the appendix, so there will be a pain in the right side. This patient is normal, so he doesn't feel any pain. In psoas sign, first ask the patient to lift his leg by keeping your hand in the knee. If he feels any pain in the right side, the psoas sign is positive, he doesn't feel any pain. And then next you should ask your patient to turn on the left side and ask them to lift their leg and then extend it back. He doesn't feel any pain. He doesn't feel any pain, so psoas sign is negative. Next is obturator sign. In obturator sign, ask your patient to flex their knee and flex their hip and keep the leg in the 90-degree position.
Do internal implantation.
If he feels any pain, then obturator sign is positive. If he doesn't feel any pain, then it's negative. He doesn't feel any pain, so his appendix is normal. Thank you, sir. Now you can sit. Thank you for your cooperation, sir. Thank you for your cooperation, sir.
Thank you.